Welcome to my channel Derma Voice. This channel is to address day-to-day concern about your skin and hair problems. So kindly subscribe to my channel so that you will get notification whenever I upload new videos. Let us look into today's video. Hello, welcome back to Derma Voice. Today I will be telling about different types of skin cancer. There are so many types, but the common ones are basal cell carcinoma, squamous cell carcinoma, and melanoma. These are the three main type of skin cancers. But in this video, I will be telling about basal cell carcinoma, known as BCC. Why it is known as basal cell carcinoma means it arises from the basal layer of the skin. That is why it is known as basal cell carcinoma. Among other carcinoma, this is less aggressive. That means it is less serious compared to the other two types of skin cancer. Usually starts as a small, shiny or waxy raised skin lesion and then gradually it spreads. But it takes months to years to spread. Like that, sometimes it may start as a tiny non-healing ulcer and keep on spreading and never shows the signs of healing. Sometimes it may start as a tiny pigmented swelling and gradually spreads. And very rarely it can start like a scar and spreads. So these are the different types of basal cell carcinoma. There are certain risk factors in this condition. One among them is fair individuals. That means if the skin type is type 1, type 2 or type 3, that means it usually occurs in very fair individuals. In dark individuals, it is uncommon. Then prolonged sun exposure. So if you expose to the sunlight, especially between 10 to 4 p.m. for a longer period of time, then chances of getting this basal cell carcinoma are more. That is why they usually appear on the sun exposed areas. Next, immunosuppression. Those who are taking immunosuppressive medications or after transplant, if they are taking to prevent graft rejection medicines, then the chances of getting skin cancers are more. Like that, personal or family history. That means if already they have basal cell carcinoma or anyone the family members is suffering from basal cell carcinoma, then chances of getting the basal carcinoma is more. Then arsenic toxicity. That means excessive exposure to arsenic or drinking contaminated water containing arsenic. In those individuals, these basal cell carcinoma are very common. So whenever the individual comes, we do biopsy to confirm the diagnosis. If it is very small, then we remove whole portion including little bit of normal skin and then send to the laboratory. If it is a large, then we take only small piece of skin and send to the laboratory for confirmation. Once we confirm the diagnosis, then we proceed for the treatment. I will tell you about the treatment and how to prevent basal cell carcinoma some other day. This is all for today. Thank you.